else? I would carry him with stairs. Like if you have a couple steps to your outside, you could carry him out and then put him on the floor. Use the harness and the leash for control, and then the sling for stability. That is going to be there so he doesn't hurt himself.
Yeah.
Keep his spine as straight as we can, and also, hey bud, hey.
Oh, relax. Oh, relax, buddy.
Hi.
She's trying to distract me. It ain't gonna work.
I know. He's like, I got stuff to do, ladies.
Bo.
And you want to use the sling to provide stability. So if he doesn't have to work as hard to keep upright, he can use his legs. Okay. So it's kind of a balance act, and we'll show you of how high to have it, because you want his spine straight. You don't want him like up here, because then he can't use his legs. Yeah. But I also don't want his paws dragging. You may have to lift him totally off if the floor with just so his hind limbs are dangling and not touching. If you're over concrete or something that could hurt his feet, because you want to maintain good skin integrity. But I do kind of like it to kind of brush it, as long as you're maintaining the skin integrity, because otherwise he can't use his legs. Yeah. If you just hold him up, he's not going to be able to use them.
That's true.
So, a couple of things that I want to show you today. You can see how Mr. Beau likes, I call this the Barbie doll sit. Remember the Barbie dolls?
Yep,
Don't bend their knees.
Yep.
Yeah, I hate it. It hurts my eyeballs.
It doesn't look comfortable.
So if he sits like that and he sits like that in his cage or whatever, like, what are you going to do? It is what it is.
Yeah.
If you're with him and you can kind of just bend those legs a little bit so they're a little more comfortable, that'd be great.
Okay.
If he doesn't let you do it and he's getting nasty, pick your battle.
Okay.
I don't want him to get nasty and then
because that's when he gets rambunctious too.
Yeah, and then he becomes unsafe.
Right.
Yeah. Then he might be like, well, I'm not letting these people do anything to me.
Yeah. Right.
So if you can get them in a nice little bit of bent position so they're not like the Barbie doll sit, that'd be great if he doesn't mind it. If he just wants to sit like that, you just have to really make sure he doesn't hurt his little hinder.
Yeah.
With
his bones and skin and hairs.
Yep. But we take for granted that when you're sitting with your legs straight, your brain automatically tells your body, okay, bend your legs underneath your pelvis, shift your pelvis over your legs, push up, balance, and then walk. And then that reverse, you take for granted that you can lower yourself to the floor. And sometimes that's hard on any given day. So with him, what I can tell is that as he's moving forward to get up, because I'm always watching these guys, like he doesn't know I need to bend my legs and do all these things. So if we can try to facilitate or improve his mechanics whenever we're working with them, so don't think of it as an exercise. Think of, well, I'm going to get him up, so let's try to work on sit to stand. Gotcha. So you're doing it a little bit often. Same thing, you're standing him and you want to sit down. That's what I tried to see if he knew what to do. Sit meant, and he's not helping me at all.
He does know what sit means.
Can I offer him some food?
Please.
Hey, can you sit right here for? Actually, could you pass me those jerky strips? Yeah. Yes.
Oh, yes. He knows exactly what those are.
Hey, monkey.
Oh, what does
she like, my nose works.
Yeah.
Tell him he has to sit.
Hey, wait. Settle. Oh, good little chewer you are.
That is so much better than the leftover food in my whiskers.
Yes.
He's like, I need a face wash. Yeah. It's right here. It's right here. Got it? There you go. Good. Beau? You can see something, can't you?
You can see around the edges.
You make eye contact with me. Good boy. You are so cute.
I know.
Oh God, you're so stinking cute. It's right here, bud.
When he gets that smile.
Oh my God, he's ridiculous.
Yeah.
And I kind of like his spunky behavior. That's terrible.
Don't try to get away.
Not that I.
That's because you
condone it, but
it's not because you haven't fully experienced it yet.
Yeah. Hey, you. So we want to keep everyone safe, and sometimes the e-collar can just keep you a little safe.
Well, yeah.
For him, it's like echolocation.
Here.
He is definitely better with it on than off. In the beginning.
Good. Well, one thing I would like you guys to do if you're hanging out with them is
was there.
Dogs normally put 60% of their weight through their front end.
Okay.
40% through their hind end.
Okay.
So just because he's going to be using his front legs more, it's like us wheelbarrowing each other. It's fine and dandy to do it too much, and then you're like, oh my gosh, my shoulder blades
Yeah.
hurt. And I think of him as a whole patient, not just his back legs.
Gotcha.
So his shoulder blade muscles are kind of right through here and right through here on both sides. Hi. So if you are hanging out with him, I just like to do some light and slow massage.
Okay.
And you could spend 5-10 minutes or whatever he'll let you do.
Okay.
He'll let you do it all day.
Oh, really? He likes it? Oh,
He
good.
loves to be touched.
Hey, settle down. So I just use a whole hand. I learned from working with people that sometimes fingertips don't feel very good. And our goal here is to increase blood flow to help the muscles feel better.
Okay.
And your hands will get really smart, as the more you do it. And even if you're like, I have no idea if he's tight or not, if he likes it, you might as well do it. But a couple times a day, 5-10 minutes, if he doesn't mind you doing some light and slow massage, you can go up and down, you could go circles, you could go sideways. But he needs to dig it, and it's not a deep tissue massage. I mean, you can go light, maybe a little medium, a little bit of pressure, but not too much. So that's just to make sure we stay happy and healthy up here, and no one wants to be moving around if everything else hurts. So,
Sure.
and only is tolerated. He doesn't like it, you don't do it. You let me know.
Oh, you'll know when he doesn't like it.
He'll tell me.
Hi. The other thing I want you to work on is standing. So we'll talk about sit to stand in a minute. He just was squirming, so I just wanted to get him up. And I understand that every time you work with him, you're going to be able to put him in good posture, sit him properly, and get to stand. If you can, that's fantastic.
He
Sometimes
is
just for
looking
safety,
for
you
food.
just got to get him up.
He's looking for treats.
You'll feel better.
So
Yeah.
in standing, what I'd like you to do is you can see if I let him go a little bit, see how he's shifting weight forward.
Yeah.
And he has this hump.
Yep.
That's called a kyphosis.
Yeah, I know about
So
that.
it means he's going here forward because he's smart, weak in the hind end, but also weak in his core, like his belly muscles and his spine muscles. Just like us, our core stability is so important. So I want to make sure when I stand him, it's on carpeting or something not slippery. I want to make sure his paws are flat.
Okay.
If he's sitting on the paws incorrectly, like knuckled over, he's not going to correct them unless he's moving. He could use his vestibular system. But for the most part, they're going to kind of stay there. So I don't want him. That's just a reflex that is not there. It might come back. It might not.
Yeah.
We'll just keep an eye on it. But what we want to do is paws flat and then paws way back underneath the hips. Okay? The biggest mistake I see people make is that people want to put them too far forward.
Okay.
So just have them back.
Okay.
So kind of like
Like a 90-degree angle.
Like you're gonna do a squat yourself.
Yeah.
So you want your hips and your legs.
Exactly. Yeah. And you can see how I'm supporting. I change my hand position based on what I see with patients. So if you ultimately come up with something that's different than me but works for you guys, use it.
Alrighty.
We want to make sure he has good foot position. Little monkey. And then see how I'm kind of slowly shifting him toward me, and look at his spine position. It's not perfect, but it's better,
than
right?
Pumped up.
Yeah. So standing might seem very elementary, but man, we have to learn to stand. He needs to learn that I got back legs. Oh, and I can extend my belly, and my muscles can fire properly. When he's like this, his muscles aren't firing properly.
No.
Hey, don't get silly. Don't you dare.
No, buddy.
Seriously, bud? You are a knucklehead.
He's after your treats.
I know. It's like, lady,
Yeah.
just give me some cookies. I can smell them.
Must be lunchtime.
So how hard would you say you're pulling back on his legs? Just gentle
Very
pressure?
gentle.
Okay.
And I'm just kind of going, okay. And I go slow. Because if you go too fast,
Okay.
he could react and pull forward. He could
Okay.
just sit down. So it's really slow. And it's maybe, it's such a small movement.
Yeah.
And I don't expect perfection. I just want better.
Sure.
And then if you can hold that really good posture I would say, I mean, he likes to stand, and I don't want to overdo it by any means, but
Right.
I would say if you could do 1 to 2 minutes, that's
Okay.
kind of maybe start with 1. Let's see how he tolerates that frequently throughout the day. And if you said, gosh, I can stand him 4, 5, 6 times a day, I mean, if you can stand him every hour and he tolerates it, I like a little bit often.
Okay.
Maybe let's start with a minute. And after a day of like, he rocked a minute, he wasn't sore, he didn't, he seemed to tolerate everything, he was still willing to do things. Go to a minute 15. The next day, go to a
Okay.
minute 30. I mean, every day, maybe you add 15 seconds if
Okay.
he looks good.
Sure.
If he starts to struggle, I'd rather have you stand him 10 seconds and look good than a minute.
Okay.
And you just need to modify based on if you think he's sore, how do you know? Maybe he's getting grouchier.
Yeah.
Maybe he's not as willing. Maybe you're doing more and he's doing less, things like
Sure.
that. And then on the way down, if you could, do you have a helper at home or is it just you?
I have a husband.
Oh, perfect.
He does travel sometimes, but he's going to be home he's
No.
gone next week, but then. So I've got
Sometimes-
neighbors, I've got friends.
Sometimes it can help having someone here to do the cookie component.
Oh. So he
And
forgets
where
what you're doing.
Yeah, and where you place the cookie is very important.
Okay.
So I'm trying to keep his head parallel to the ground,
Okay.
and I'm trying to keep it in his face. If he's reaching
Okay.
forward,
Right.
he's gonna
Sure.
pull away from me.
Right.
Sure.
And then you could say, okay, bud, we're gonna sit. So I want those hind legs to stay where they're at.
Okay.
Hey, bud, can you sit? Beau, can you? Oh, you trying? Good
Yeah.
boy. So
when
could I
he's-
have you hold this for a moment?
Yes. So when you're doing that, are you trying to
Right.
kind of still pull back on his back
So I'm
legs
trying to
slightly?
kind of pull back and then go into like an accordion.
Okay.
You know what I mean?
Yeah.
So if I'm here, can you ask him to sit?
Sit. Bo.
Oh, say it.
Sit.
Sit.
Say it like you mean it.
Sit.
Sit. All the
Sit.
way, pumpkin pants. You got this. Come on, sugar.
You sit now.
That's what you got to do.
Beau,
Okay. Bo. Sit.
You're trying it, buddy.
Sit.
Here.
Sit.
Good. Good boy.
Beau, can you sit? Sit.
Oh, you got the right
Good.
You got the right sit.
So, and then his legs will probably go into Barbie doll land. But
Okay.
so what I tried to do is I always want to see if they'll start it. So as soon as you said sit, he did kind of go, okay, I'm going to shift weight. And then I had to really keep him there because as soon as he goes back, if he goes back too far before he starts to bend his knees, whoosh, I mean, that's what's going to happen.
Yeah.
So I play around with it.
Okay.
And you can give him a little, like I probably did that much
Oh, pressure.
on this bone way back here above his tail. So
Okay.
it's our sacrum bone, that
Okay.
big box that you have on your pelvis. I don't want you pushing on his
I
spine.
don't want to.
But if you can kind of just have your hand there and then he's kind of lowering, if you can get him to go halfway down or fully down before he goes into this position, do your best. And it
Okay.
sometimes can help having someone in front of you with some sort of cueing.
Sure.
Same thing on the way up. I mean, if you can bend, so he's pretty stiff, so that's called tone. So if I can't bend him, I don't want to just force it, but if I do a nice little squeeze, and again, I don't want to make him mad at me,
No, you don't.
of his toes, and see how I can get that one at least under him, and then, so if you can get those legs a little bit under him, he's going to be able to push through them,
Okay.
versus, he's not doing anything if
No.
he's just doing this.
Yeah.
So that stiffness is not him being a knucklehead. It's just his neurologic
just- you
issue.
can't help
So
it.
sometimes what I'll do is I won't use my fingernail. I'll use my pads and then go in between like his webs,
Okay.
in between his toes on his webs, and I'll do just a little squeeze,
Okay.
and that will elicit a little bit of a bend. It's a reflex. It's a great way to cheat.
Yes.
So if you
it is.
need to use it, you can.
Okay.
As long as if you keep doing it and you hurt him, that's not the intent of it. It's just
No.
there to see if you can get him to bend his knee a little bit without him reacting. Like he should act like nothing is going on.
Okay.
So, bottom line is if you can try to, hey bud, can you sit? Hi. Hi, sexy. Hey, Beau. Pumpkin.
Beau Manchu, sit.
You sit?
Mama says sit.
Oh, you are just not going.
No, he's not cooperative today.
Sit, Beau.
Oh, good. Good. You're trying. Good. Sit down, Beau. Good boy.
Sit.
Fix your feet.
Sit, Beau. Sit. Yeah.
Come on, mister.
He's giving you guys a look, just so
Sit.
you know.
Sit.
Good.
Sit all the way down.
Oh,
Sit.
what a good boy.
Sit. Sit.
What a good boy.
Sit.
What a good
Yay.
boy. Good job.
Yay.
And look at if he's in
Good
this position.
grief, you took a hunk. You are just a snarky little thing.
See how easy he gets up when you have his legs bent?
Yeah.
So if you can, and I'll write this down, if you can try to work on kind of getting his legs a little bit underneath him, I don't expect you to be able to get them all the way. I mean, if you can get those legs underneath him a little bit, and then you can go, okay, let's stand up. He's going to be able to use more.
Okay.
And if he uses more, he's going to get stronger faster.
Sure.
If you can encourage a nice, slow stand to sit, great. If he's not participating and you just need to control him and put him in a safe sit, like, okay, bud, let's sit. I mean, however you need to do it.
Okay.
And as he gets better, he should be starting to do that flexion on his own, and you shouldn't have to do as much. So would it be possible in your world to stand him 4 to 6 times a day?
Oh, yes. No problem.
And try, I know people are busy, so if you can, like, if you say, gosh, 4 times a day he's out to pee, maybe I'll stand him outside, or when I come back from outside and you're inside on the carpet, I stand him. So that's already 4 times a day.
Yeah.
If you can stand him during some commercials. If you can, does he have an elevated food dish?
He will have.
He will
Oh,
have.
perfect. So that's kind of
I was
nice.
gonna say not at my house, but
So
yeah.
he'll still be shifting his weight forward a little bit.
Okay.
And he has to be able to, do that to eat properly. But that could be a nice way. I mean, you're not going to have perfect posture, but
Yeah.
stand him when
How
he's
high
eating and
should
drinking.
it be?
I mean, they should just kind of,
Just kind of go
just
forward.
lower. Yeah, you don't
yeah.
want him reaching for it, but
Yeah.
it should be. I mean,
Okay.
he'll have to reach forward, so you won't. It'll be harder to have that perfect spine position,
Okay.
or as perfect as you can get. But that's a nice way to work a little bit of standing into the day when he's eating and drinking. So we talked about massage a couple times a day.
We did.
Standing, if you can work on the sit to stand, stand to sit.
Okay.
Otherwise, as safe as you can do it. If you just need to put him on his hip, that is fine. I don't want him grouchy. I don't want him to be a knucklehead, and I don't want you to get hurt, and I don't want him to get hurt. So
Sure.
do
Sure.
what you think is best.
Because he is still a puppy.
Yeah.
He's pretty young.
He doesn't know.
No.
He said, I just want to be back to the way it was.
The other thing I would like to give you, since he does have some really nice motor function, I mean, you can see how he's moving his hips
Yeah, he's
nicely.
trying
He
to
moves a
make them
little bit
go.
of his knees, but not very much. Would be some passive range of motion,
Okay.
because he is not going through those movements. So I'm nervous he could get potentially tight.
Yeah.
If you're able to work on that sit to stand, could he potentially, hey, good boy. You could be working on that flexion. I don't know how consistent you're going to be able to be with his behavior. I'm not sure.
It don't work. It's not gonna. We got to get to know each other a bit.
Yeah.
I
Hey.
have nobody to focus my attention on right now.
Oh,
My
maybe
husband's can be on his own for a while.
I was gonna say maybe we can teamwork it.
Sure.
If you
I
if
have
you
trouble
need
or
help,
something,
yep. If you need help, I'm more than
Shout out.
willing to.
We'll see how much trouble. he
Yeah.
gives
so if the ideal position would be him laying on his side for
Okay.
this. If you see him napping, maybe do it then, but don't startle him.
I was gonna say don't play with him while he's napping.
Oh,
Just so
really?
you know.
Okay, so not when he's napping.
Okay.
But if he's laying down relaxed and he's
Yes.
hanging out with you,
Okay.
give it a shot.
So like if he's sitting in the chair beside her,
Yeah, he could kind of be on his elbows and his hip.
Okay.
That'd be okay too.
All
This is
right.
hard to do this if he's standing.
Standing. Got ya.
Or sit. I mean, not standing, but sitting.
Okay.
You could also try something like, hey, settle.
Bobo.
If you have
Hi,
him
Bobo.
here, basically, you're just kind of flexing him.
Okay.
Hey.
Bobo.
I
Beau
like to
Manchu.
use two hands, but I will. I mean, if he's by you, and you can just kind of flex those legs up.
Okay.
So you're seeing I'm bending his hip, knee, and ankle, and then I'm kind of just pushing on his thigh to get that nice straight position,
Okay.
which you
Beau.
kind of get when you're standing with him.
Yeah.
Bobo.
And if you can bring his hip back, Beau.
You forget you're not supposed to pay attention right now.
If you can bring him back just a titch.
Okay.
I wouldn't go very far though. So if you're bending, he has normal range. So our goal is just maintenance
Gotcha.
and then straightening. So if he lets you do, I mean, ideally it's 10 to 15 times, 3 times a day. So I'll write that down for maintenance.
Okay.
If he gives you 5 and you're like, okay, his range still looks great. I don't care if you do just 2 of them. If our biggest goal is just to make sure he doesn't get tight.
Okay.
So whatever we can do within a tolerance level of his
Gotcha.
and a safe way.
Right.
He's being very good today.
So far you are.
I tried to do it in standing, but with his tone. I mean, you could also do it here. You're not going to be able to work on as good a posture, so it'd have to be like you're not doing it. I mean, you can try to do it with good posture. It's just hard. But if you could do this kind of up and down like this and kind of bring him back a little bit and then do it on the other side. So if you do it in standing, I might just do like 5 and just support him under his pelvis.
Okay.
You know, because then you'd have to get the other side
Yeah.
and do it, but that tone might prevent you from doing it in this position. So it's hard on the left. He has a lot more tone on his left.
Does he?
Yeah.
Okay.
Oh my gosh! Now you're wearing this like a
Yes.
there.
You're
Thank
kind
you.
of a tangled little thing, aren't
So
He's sneaky with those.
yeah. So I think a harness would be wonderful.
Yep, and he has a harness in the car.
Perfect. So safety, good skin integrity, making sure the shoulder blades feel good. The range of motion is to maintain the flexibility of his back legs. And then standing a little bit often, and you can increase that standing time every day based on how he does.
Okay.
Do you want to make it harder? And then look for him like, okay, I don't have to do as much. Like I have to place him, but I don't have to shift him back as far. And oh, he's actually going to sit on his own and it's not a struggle. So hopefully that will improve fast.
Okay.
So you don't have to feel like you're doing so much or, oh gosh, you know what? He's just not cooperating from sit to stand with his legs bent, but now he's bending those legs and pushing up versus me having to just pulling them up from a Barbie doll stand.
Yeah.
So look for those little things to
Beau.
note little improvements.
Thank you.
If he doesn't tolerate something, I don't want you to do it, and
Okay.
I want you to let me know. But these things, I think, are what you really need to focus on those first couple weeks.
Okay.
Safety, mobility, maintenance, letting these guys feel good in his standing, and then the sit to stand, stand to sit, hopefully will be improving.
Okay.
Rehab isn't required after today, but very highly recommended, just like in human medicine.
Sure.
I tend to treat just like I treated in human medicine, where it's great to have them come in intermittently. We reassess, make sure we don't have any red flags. If I have a worry, I have a surgeon look at him, and they're at my fingertips, which is really nice here. Can I have that treat?
Oh, yeah, I'm
Thank
sorry.
you.
You're
Always
going to
like-
be exhausted, buddy, but you got a long ride home. You can sleep.
And then so we reassess, and then we might do some things here that you can't necessarily do at home. But a lot of it's going to be like, okay, what do we need to work on? What's safe for his spine, and what is easy for you to do that's also going to be therapeutically appropriate for him.
Sure.
So I love to give homework assignments and give you ways to make them easier or harder, because sometimes we just need to make them easier. I see one thing, but at home it might be different. You never know.
Yeah.
And then we can progress those things. I wouldn't want him swimming right now because I think it could be too unpredictable how he moves in the water. Yeah. But something, like the underwater treadmill, we could always incorporate. That's my big purple monster.
Oh, cool.
Not the best for everybody, but we do it if it's indicated. Hey.
Hey, settle down, buddy.
And if you find that he has like a Kong at home that he likes that you can fill, or a favorite toy you want to bring to his therapy sessions that can
Okay.
keep him happy,
All right.
that's great. Where are you guys from?
Cedar Rapids area in Iowa.
Oh, in Iowa.
It's like 2.5 hours.
Yeah, I was going to guess 3.
Yeah.
Um,
Dubuque is halfway.
Okay. Dr. Budgeon wants to see him at
2 weeks.
2,
4
4, and
weeks
8.
and 8 weeks. Yeah.
So I think we were planning on scheduling the same with you
Sure,
at
sure,
that time.
sure.
He said you were good at coordination.
Oh, I do my best. You stay here for a second if you can hold him. Hey,
I'm gonna